Nicola, this is really interesting, isn't it? Because it not only pertains to people who have been diagnosed with the virus, but those who may never know they've had it, the asymptomatic cases. Because whether you're asymptomatic or not, you have the virus, so it could potentially, could it not, damage your organs without you even realizing you ever had COVID-19.
Oh, that's exactly the case, Adnan, particularly with Sam Johal, whom I interviewed there. He had no symptoms at all. The only reason he'd gone for the coronavirus test was because his parents had had it and he was offered it at work because he's a diagnostic radiographer. So he thought he'd go along, he'd get tested, was surprised that it came back as a positive because he hadn't had any symptoms. Volunteered for this cover scan study, and yet they've shown that he's got damage to his heart. Now it's minimal, and he thinks that he can strengthen his heart muscle if he exercise and diet and a healthy lifestyle. But we don't know. We'll find out if that is the case when he has his second scan in January. I mean, he was just one of 79% of the people who have been scanned on this study who weren't hospitalised. So they either had minor symptoms or no symptoms at all. Now, Sam said he felt slightly guilty because he knows other people who've had long COVID. You know, they're tired, they're still in bed 6 months later. And a lot of those people are now calling for scans to find out what the long-term implications has happened to their organs. Mary Zhu, whom I interviewed in that report there, said that, you know, they were quite surprised with these results. They were looking for damage to the lungs because, of course, when they set this up, that was when we thought the virus mainly attacked the lungs. But what they found is it's damaged the heart, as in Sam's case, the kidneys, the pancreas, major organs of the body. Lots of people have got extra liver fat. Now, they can't say that all of it is down to coronavirus. Perhaps some of these people did have underlying health conditions. Again, it's when they do this follow-up scan 6 months after the first one that they'll be able to see whether there's been any change. But it does use, you know, as you've asked there, it does have implications. It does mean that the virus could well be damaging your body's organs without you realising, because you thought you just were asymptomatic and had shrugged it off like the flu, as certain people have said.
Yeah, absolutely. I mean, you're speaking to us from a country, and luckily enough, you have free healthcare at your disposal. So do we here in Turkey. But you think about a country like the United States and the debate that's going on there about Obamacare, about the Affordable Care Act. And of course, if you require health insurance, it's also about your pre-existing conditions. So if you've had COVID and you've got some sort of pre-existing condition with a major organ, that will create its own problems. And then there are the issues of what it's going to do to healthcare systems months and possibly years down the line if people are going to need longer term treatment.
Well, that's something that Mary Zhu definitely highlighted, the fact that they are going to have to look at this as much more of a holistic disease and to think it's not necessarily just coronavirus. I mean, we've been talking about this non-stop since we first found out about it at the beginning of the year. But in terms of disease knowledge, that's a very short period of time. So normally when you actually sort out what long-term treatments, you've had that time to develop them. If you think of Sam's heart condition, he's a healthy 30-year-old man. He probably will be able to strengthen his heart. But other people whose hearts have been impacted may well go on to heart failure, might need to have particular medications in future, which if you're in a country that doesn't have free healthcare is certainly going to cost. And this is what all health systems worldwide are going to have to start considering.
Nicola, as always, thank you so much indeed. Nicola Hill with her regular contribution here to the NewsHour.